Finding Hope, the Road to Recovery.
Hi, my name is Colette Rotmil. I am a licensed professional clinical counselor. I work at Tarzana Treatment Centers as a clinical supervisor. This is a new episode of Finding Hope, the Road to Recovery, opening the door to a new life. This is part one. We're going to be talking about addiction and the road into working in the field. And my guest is Guy Sherk.
Hello, everybody. My name is Guy Sherk. I am an outpatient counselor at Tarzana Treatment Center as well. And we're going to hear a little bit about my story from active addiction into recovery and into working in the field of recovery.
So we'll start with Guy's experience, maybe how you started, your background into using.
Okay. Sure. Like a lot of us, I saw drugs and alcohol at a young age. I saw a little bit of the alcohol in my family growing up, in our society, and so forth. And I also saw some of the negative consequences of it as well. Our father, a little bit of a drinking problem, and I found out about some of the negative consequences of it as well, but I also saw some of the joy that it brought people. I would even hear about some of the negative consequences through the school programs, like the DARE program and so forth. But at some point during my adolescent years, I decided to partake in some alcohol use and maybe some marijuana use as well. And I actually really liked it. It was kind of soothing for me, like a lot of us. But I don't know. Something I learned is that some human beings just seem to like it a little bit more than maybe others. And I guess I was one of those people. So sure, I started off, throughout the high school years of drinking a little bit, partaking in some marijuana, and, without very many negative consequences as a result of it. Maybe throughout those years and even into my college years, I started experimenting with some of the other substances that were out there. So that was out of curiosity, out of hearing about things from other people, and I partook in some of those as well. Like I said, I enjoyed the effects of alcohol especially, and some of the other substances, and there wasn't too many negative consequences as a result of it. Until, I started noticing a few of the things early on, the hangovers, or maybe not remembering something I did the night before, but able to laugh it off. And just from what I've witnessed and what I've seen with other people that drank or did any of the substances, it was maybe just a normal part of it. So I did continue on with that. I was still maintaining in life. I went to college out of high school. I was playing sports as a young child, and friendship relationships were good. The family relationships were good, until I started noticing a few more of the negative consequences. You see, I kind of like the maximum effect of some of the substances, especially the alcohol. So I started wanting to do it a little bit more, and maybe even stronger doses of it. And I would partake in it to the fullest, and every once in a while I would see some of those negative consequences. And eventually, there was some of the consequences were of the legal variety. So, you know, I would be able to, I would always be trying to control and enjoy my alcohol and drug use. And sometimes if I noticed that there was a negative consequences with one of them, I would try to put that one down and maybe switch over to a different one. And that carried on for a good decade or so of, you know, trying to manage my drug and alcohol use, which I've seen other people do. And I knew that at one point maybe I was able to. I was able to manage it. But my journey continued with the negative consequences building up. And my enjoyment of it still was somewhere in the middle. Negative consequences about here. And eventually, like I said, because of the legal situations, DUIs, possessions, and so forth, some of those consequences started building up. I also started noticing some negative consequences in my relationships with other people as well. Friends, romantic relationships. I ended up getting married. And at that point, my drinking had really escalated into a habitual sense, and I was doing it on a daily basis, and probably doing a little more than maybe I should, and maybe a little more than I wanted to. But still, in the back of my mind, thinking that I could manage it and control it. So, as those negative consequences were building up, some of them got really bad. I remember my ex-wife used to have me maybe take a break from the relationship, or even go stay with family for a while until I could maybe straighten out. And you know, I would make promises to her or to employers that I would show up and be responsible at my jobs, in other friendship relationships, family relationships, family functions. I would tell myself that I was going to get better.
Right. And would you believe that, though? Like, you believed at the time that maybe it wasn't so bad and that you could?
That's an interesting question, because sometimes I wanted to believe, but I also wanted to be able to partake, right, and to continue with my alcohol and or substance use. Mm-hmm. And I think that's one of the interesting points of someone with a substance use disorder when they get to that point. It's a state of ambivalence, I would like to say.
Right. Or justification, or minimization.
Rationalization,
right,
minimizing. I did a lot of that.
Right.
Sometimes to others, and sometimes even to myself. Mm-hmm. And you know, I continue to tell myself that maybe it wasn't so bad. Mm-hmm. That's a good point, and I think that's a point that a lot of people someone with a substance use problem does get to. So I continued on until I have a sobriety date of January 13th, 2017. And about 5 years before that, I realized that it was a major problem in my life. The thought of stopping was there, but how do I do that?
Right. Can I change?
Can I do that?
Right.
I know I needed it.
Mm-hmm.
I knew that I wanted it at that point. Right. I wanted a change. But how was I to do it?
Right.
So, at that point, I was introduced to some of the programs through the legal system. Of course, I was assigned to some alcohol classes as a result of my DUIs. I was given the option to go to some Alcoholics Anonymous meetings in order to maybe not do some jail time, and I accepted that. But part of me was a little hesitant and a little resistant towards making a complete shift into that lifestyle.
Right. Did you find at the meetings that you started to get some hope that you could change, that your life could be different by listening to some other people's experience, strength, and hope there?
Interesting question, because at the moment I did not realize that.
Yeah.
And if I did, I couldn't accept it. I couldn't accept it. I thought that maybe I'm different. I'm glad it worked for them, but for me, nobody understands me.
Mm-hmm. I'm unique.
I'm very unique. I was very self-absorbed. Mm-hmm. And my world revolved around me, and I didn't know if anybody else could relate to me. Even though I did get some glimpses of hope. Looking back now, I did get some glimpses of hope for recovery.
What were those? How did you get those?
I guess although it was difficult, learning to listen to and and somewhat relate to some of the experiences that somebody had.
Right.
Someone would talk about their run-in with the law, or their problems with their family, or their relationship.
That maybe you weren't so different, that they had something similar.
Sure.
Yeah, gone through.
And then they would share about their, maybe their strength of how they got in recovery, and then how different their life is now that they are in recovery. And that was the hard part for me. It just seemed so far off to me and almost unattainable, even though inside I wanted it.
Yeah.
Very much so. I did want it really bad. I wanted something different.
Did you think you deserved it?
That's an interesting question too. A lot of times I probably didn't. That's a great question. I didn't think I did.
Or
I was throughout the years of my drug and alcohol use, I made a lot of bad decisions. I had some bad actions towards other people, towards not treating myself well. And in time, that guilt, it turned into a shame for me as well. Right. And I started to internalize it a little bit. I saw some of the negative aspects of alcohol and or drugs in my family, and I've seen some pretty negative aspects of it, even death and so forth. And I knew there was a way out, but from where I came from, it wasn't very common in my family to ask for help or to seek help.
Right. So when did you decide that you could get some help, and then you sought it out?
Okay. Yes. My life was very unmanageable and very much in shambles. I was losing jobs. I was losing places to sleep. Even losing my family. My family couldn't deal with my alcohol use and or substance use. And my physical health was shutting down. I've had many trips to the hospital as a result of my drug and alcohol use. And I was at a low point. I was without home. I was without work. I was without respect and love from from my loved ones. And most of all, I was without self-respect and self-love. And you know, my body would physically shut down if I didn't have alcohol in my system. So, and you know, I would go into seizures.
Wow.
Yeah. And so I was at one of those points, and I knew that I needed help. So luckily someone was in touch with me, and who cared enough to get on the phone with my sister and take me to a hospital, which I've been before. At the hospital, I still don't know this woman's name, but someone came into the room and talked to me that night and asked me if I've ever done proper treatment. So I said, no, I have not. And she mentioned a place, Tarzana Treatment Center, would have a detox bed for me in a few days. I knew I couldn't make it a few days. I was leaving the hospital, and she comes and says, hey, they're coming to pick you up right now. I woke up a few days later in the detox of Tarzana Treatment Center, not knowing where I was at. And then as it came to me, I realized that I was getting help. And I had a type of surrender and willingness that I never had before. I was very beaten down, and not like I wasn't before, but in a way that I became just somewhat willing. I was out of answers for myself. So I started to listen to the staff that worked at the treatment center. And at the treatment center, even in the detox level, because I was afraid to talk to anybody.
Right.
I was very, very uncomfortable with talking to anybody, especially about my drug and alcohol problems, not even my family. So I met some people that worked even in the detox that also had drug and alcohol problems and were working there. And they would have some interesting conversations with me. And maybe allowing me to open up towards continuing treatment.
Right.
Even
Giving
though-
you some hope.
Some hope.
Some hope that maybe I can get the help
Yes.
that I need.
And that is the name of this program.
That's right.
And
My life can change.
so I decided to continue on. I stayed in the treatment center in the residential program for another, 4 or 5 months. Even though it was completely foreign, I felt like I was fine. But I kept listening. I kept listening to the staff there. I started talking to some other staff members there. I saw a therapist for the first time, who was not in recovery herself, but for the first time, I started talking to doctors. I started talking to other people that were my peers in the treatment center. I started listening to them. They started listening to me. I had a counselor. Eventually, I made it into the outpatient program. We moved out of the residential program into outpatient. I was living in one of the sober living houses, and that's where I met you, who did my intake into outpatient, and that was a whole new journey of living out in the world, but continuing to come to treatment. And that's where I found that it was a good idea if I continued to do that. And at that time, I was introduced to many other counselors and staff that also were in recovery, and helped me to even get more involved in the recovery world out there, in the meetings, getting a sponsor. I had someone who was my counselor in outpatient, who would talk about a 4-point plan of going to 90 meetings in 90 days, getting a sponsor, getting a home group, getting a commitment, and guaranteed that this would keep me in the path of recovery. I was hesitant. I was a little hesitant on listening to that and actually doing it, but eventually I got a little desperate in that first year, and I decided to get involved in the programs out there. As a result of that, I started working again for the first time, clean and sober. I started being accountable. I was showing up to my groups. I was learning how to live a life that I always wanted without the effects of drugs and alcohol.
Right.
My obsession for it was being lifted. And it was a very critical part to my journey. And you know, I fell in love with the idea of someone who, and I became comfortable with someone who had a drug and alcohol problem, and they were trying to help me with my drug and alcohol problem. And, you know, whether it be someone like yourself, who I felt comfortable talking to, some of the other staff members, my sponsor, my fellow patients that were in the treatment center with me. And I started learning how to trust. I think that was a big part of me letting go of myself as much and learning how to incorporate other people in recovery into my life. And that's where my journey really took off, of wanting to help others as well. I was very interested in working in treatment.
And why? Because of the gift that you were given.
Yes, very much so.
Which is why a lot of us go into working in treatment. To give back, it becomes a passion for us to help the next person.
Yes, and I think in the next segment, we are going to talk a little bit about that.
Yes. And
how much that brings into my life and your life, I'm sure, too.
Mm-hmm.
So,
okay, we will be right back. We're going to take a short break, and then we'll be back with part 2 and talking about working in treatment. Hi, we are back with Opening the Door to a New Life, Part 2, Finding Hope in the Road to Recovery, Colette Rotmil and Guy Sherk. And we're going to be talking now about working in treatment. Guy, do you want to start?
Okay. Hello again, everybody. Yes, so as I was learning how to live a life in recovery, I was very intrigued about working in recovery as well. I thought that was a great option of someone who came from a similar background as me, sharing their experience with me, their strength of how they recovered, and then giving me the hope of how I can continue this. I thought it's just an amazing aspect of learning how to pass it on. And so I eventually kept in touch with a lot of the people that were at Tarzana Treatment Center. I had a job. I was working out, not in treatment for a little while, and I was holding down the job. I was doing a good job for the first time in a long time. And eventually, I was given some opportunities to maybe work at the treatment center that I went through. And there was a couple opportunities in different departments, but I really fell in love. I was very intrigued, and I liked the transformation that was happening to me while I was working while I was a patient in the outpatient program. And an opportunity came for me to get a job there as what they called a technician, or a peer support technician, as they call it.
Now it's called peer support specialist, but
peer support specialist.
To be technician,
right.
Yeah.
So I just needed my experience as a patient, and my high school diploma, which I had, and so I decided to work in recovery, and it's been an amazing journey since then. I started off as a peer support technician, and I, would kind of assist the counselors on different aspects of working with the patients. I would do testing for the patients. I would talk to the patients, and they enjoyed talking to me. They knew that I had been through that program as well, and it was very nice to give back a little bit. Some of the people that were helping me, I was now working side by side with them. Mm-hmm. And it felt like I was becoming. A lot of my first part of my story was my transformation of learning how to live a life in recovery, and now I was able to give back.
Right.
And it was a very very rewarding. It's been very rewarding since then. The other people that worked in recovery were also very welcoming and help. They were helping. They were offering help, and I started to realize that there was different areas of growth that maybe that were available while working in recovery. So I knew that I would have to go back to school. I was in my 40s and I had to go, and I was like, oh wow, I have to go back to school if I would like to maybe become a counselor.
Right.
And that was a little scary at first. Mm-hmm. But I started to realize like that so many things were available to me, and I was able to accomplish things now. Where before I would let that fear and that discomfort just prevent me from
stepping out of your comfort zone to move forward.
Yes.
Sometimes that's difficult.
Very much so.
Yeah.
And I had a lot of encouragement from you as well for going to school, and I did. I went back to school for the first time in almost 20 years. And I didn't know what to think about that. But I did it. I was interested in learning about the treatment of substance use disorders and addiction and so forth. So it was intriguing to me. And it was quite amazing that when I'm not doing drugs or alcohol, that I can actually do better in my jobs or in school. And that was very refreshing. So little by little, my confidence started building up, and an opportunity arose while I was working in the outpatient department with you, Colette, where Colette herself, she became the clinical supervisor.
Right. I had been a counselor
Yeah.
for 6 years, and then I became the clinical supervisor. And then I said, Guy, you're in school and you're registered, so come work for me.
Yes.
As a counselor.
As a counselor. It was another big step of...
And you're like, I don't know.
Right.
But then you did.
As a peer support technician, I was affecting people's lives.
Yes.
I was talking to them, sharing my experience.
Definitely.
Sharing my experience of going through treatment and how I ended up where I was at today. That was a good thing. But I knew a counselor was one more step up from that.
Yeah.
I would be running groups where I would have multiple clients or patients and have a caseload.
With patients one-on-one, Yeah.
But it was something that was calling me. Something that was calling me. Even though there was still a little bit of fear and uncertainty and, oh no, can I do this? But there was something that felt right about it. Something inside here that felt like it was the right thing for me to do. And I enjoyed it. So many times you hear from people that, you know, try to find your career or something that you enjoy doing.
Yes. It's most people that come into counseling, they have a passion for it, you know, and it doesn't have to be that you're in recovery, but most are, but not all. We have a lot of counselors who are not in recovery, but have been affected by addiction in one way or another and want to help the next person.
Right.
So,
and I did experience that for sure, that it felt good, like I said, and it felt like it was a calling for me.
Yeah.
And, you know, by working in that field for a while, I started realizing that maybe I'm effective as a counselor.
And that's wonderful to see.
And I got to see, yes. And I was able to do it, number one. And number two, I was able to see it working.
Yeah.
Working in the lives of other people that have struggled with drug and alcohol problems. And I've seen it working in their lives. And this is something that it's almost unexplainable to maybe somebody else unless you get to experience it. You know, my experience is able to help the next person with their experience.
It's rewarding to do that.
Yes.
It's rewarding. It helps, just like a sponsor helping a sponsee. It's like you've been given a gift of recovery and then you want to give back. So working in the field, you get to do that. And you get to do that in other ways too. But this is one way that some people can do it. And it's worked for you and it's worked for me. I've been doing it for quite a while myself. I went to school first and then went back to where I went to treatment in Vermont and became a case manager and then a counselor. And then I was a supervisor there too for a little bit, but I moved to California and I started as a counselor at Tarzana Treatment Center. It was my first job out here, and I worked here for 6 years, and now I'm the clinical supervisor. And I thought, I want to be a counselor. I don't really want to be a supervisor, but that's the next step, and now I get to help people like Guy be counselors.
Right.
So
it's almost
still rewarding.
Yes. It reminds me of the circle of life.
Right.
This is almost like a circle of recovery.
Yeah.
And there's so many different ways that we can help each other. And it's very rewarding and so brings so much joy watching somebody else and assisting somebody else, allowing them to help themselves in with their new life.
Yep.
Opening that door to a new life. It's
seeing that growth and change. And even if somebody doesn't make it right away, you plant a seed and they come back. True. You know, sometimes it doesn't happen the first time, but the seed is planted, you show support and you're there and they know you're there. And a lot of times people will come back to us, multiple times even sometimes, until they get it. But they know that they can come back.
Very true.
Because you develop that connection, and
yes,
it's wonderful.
Yes. You know, for so many years, I just thought that it was unattainable until, you know, luckily for me, I said yes to saying, okay, going through a hospital to a treatment center.
Right.
To where, you know, it gave me the opportunity to start putting together some time away from the substances, start learning a little bit about how I stay away from those substances.
Right.
And how I can live a life without it, it sounded so foreign to me. Absolutely. For so many years. Yeah. It sounded unattainable. It sounded unimaginable.
Right. I didn't think I could have a different life. I thought, this is my path. This is, you know, my life. I I can't have anything different.
Yes.
But then I had some consequences, and I started to also, I was kind of pushed into treatment, you know, for legal reasons. And then I started to see, I think I can have a different life. And I went with it. I went with it. And then here we are.
Yes, here we are many years later for you, and you know, quite a few years later for myself. And I remember when you would share your experience and strength and hope with myself and with the other patients when I was going through treatment, and to watch you become a counselor into a clinical supervisor role, and now being able to teach me through my counseling phases. I'm very fortunate and very grateful as well that this does exist and that recovery is real.
Yeah.
I can go on and on about the thousand people that have helped me in my recovery journey, just by sharing and me listening. It's quite a process. It's quite a process, and very rewarding and very well worth it. I thought, and it's something that I'm continuing on today as well.
Right. You finished school, and now you're moving to the next step in your certification.
Yeah.
Getting ready to take your test. Yeah.
And I'm still, you know, I still feel like I'm learning, and that's a good thing, I think.
We're always learning. I mean, I've been doing this for a while, and I'm still learning, you know.
Right?
Always learning, yeah.
And
things are always changing, and there's always more research. And
sure. And then there's always new people to help.
Right.
It's always a new experience. And
definitely doesn't get boring.
No.
We have a great team. We have a great team of people that we work with in our program and in the agency, Tarzana Treatment Centers.
Sure.
Always growing, always offering integrated services. So you have mental health, you have MAT, you know, medication-assisted treatment, primary care, you have everything. So it's really great to be able to meet everybody's needs and help them, because you need to meet all your needs. You know, maybe you don't take care of yourself physically, or you have medical issues or your mental health, and a lot of times that will lead you back to using. So we want to make sure everybody gets all their needs met so that they can be functioning and healthy.
Yes. Healthy and functioning and
helping people get jobs, and there's a lot of free housing now that we have, which is wonderful, so people can have time to, with the recovery bridge housing, have time to get their act together, you know, get a job, save some money, you know, get stable, all of that, you know, while they do recovery and get a good foundation.
Luckily, there is the resources available. And there's people that will be there to help. Yep. And today we get to be on that side right now. Yeah. It is possible.
We guide them. I always say, I'm guiding you. I'm giving you the tools, giving you the guidance, and then what you do with it is what you do with it.
Sure.
So
at the end of the day, it is up to us as individuals of what we do with it. And it's been such a journey, to say the least. You know, some of the people that I have helped, when you brought up showing them that new life, we get to see so many people make those changes, but not just a new life, but sometimes we're giving people just life period.
Right.
You
And
know?
the happiness that they show that's different. They may come in broken or, you know, sad
Yes.
and, you know,
Sad and
not healthy and
not healthy, near death.
Yeah.
I believe
And
that
then to see that growth and that change.
we get to
and,
save lives.
Yeah, absolutely.
And it doesn't get any better than that.
Mm-hmm.
Just to be able to give the gift of recovery and pass it on and show someone how they can transform their life into something new.
Hope that they take the chance, but knowing that,
Mm-hmm.
letting them know we're here when they're ready if they're not ready at that time.
That's right.
And they do. They come back.
Mm-hmm. Very much so.
Lots of opportunities at Tarzana Treatment Centers, school.
Yeah.
We have a lot of patients who actually can go to become a tech now and take the course for peer support tech and then have an opportunity to get a job.
Mm-hmm.
At Tarzana Treatment Center, we have a lot of patients who get their RAD-T registration for substance use and get jobs
Right.
in the community at different treatment centers and then maybe come to us eventually.
Sometimes.
Yeah.
Yeah. And just like in my experience, it was just so foreign to me. I didn't know how you would go about doing this, or I didn't know it was even an option.
Right.
To be able to help someone else like that. And luckily that there is resources out there and people like us that can show people, direct them to the path of, of being able to work in this field.
Maybe getting a GED first, maybe,
Sure.
Taking a course.
Mm-hmm.
Yeah.
Yep. Yeah. This. I remember someone used to tell me it's like a life beyond our wildest dreams. Because I couldn't have imagined this before.
Mm-hmm.
I really couldn't have imagined living not so much just even without drugs and alcohol,
Right.
but just being okay with life and being happy with myself and me in life.
Right. It's so different. It's like another life. Like I feel like I have a new life. Like that was my other life, even though it was my life for many, many, many years.
Right.
This is like a new life that I never thought I could have.
Yes.
Yeah.
And here we are.
And here we are. And, okay.
All right.
Well, thank you so much. It was wonderful being here. And
For anybody out there, hope you get something out of this.
Yep.
And keep the hope alive.
Until the next time, the next episode of Finding Hope, The Road to Recovery.
Brought to you by Tarzana Treatment Centers. You can visit our website at www.tarzanatc.org or call 1-800-996-1051.